The health challenges facing cities today, I think, are numerous, but generally they also vary from region to region in high-income countries and in low-income countries and middle-income countries. Today, I did talk about the challenge of slums, and when you look at slums, one of the points I've highlighted is the role of respiratory tract infections, particularly in under 5 mortality, which is about 36% of the deaths of children under 5 are due to respiratory tract infections. And for adults, especially for men, injury deaths is really the leading cause of death, accounting for about 1 in 3 deaths of adult men 15 years and older. And many times these are not drivers, are not issues that we see within the health sector. Within the health sector, you don't really deal as much with injuries. You don't deal as much with air pollution and all of these. And these are the contexts within the urban environment that have huge influences on health outcomes.
Finally, what opportunities are evolving that are, in your opinion, the most important opportunities for good governance of cities?
I think for good governance of cities is really to recognize that we do not, our definition and measures of urban indicators is flawed very significantly. When we have large proportions of the urban population living in slums, like in sub-Saharan Africa, where close to 52% of the population live in slums, 55% of the population, of the urban population live in slums, having one definition of urban that covers slums and non-slum areas within urban settings is very misleading, because the difference between slums and non-slums is larger than the difference between urban areas and rural areas. And if the main reason why we separate rural areas from urban areas is because of the differences between the two, given that those differences are even larger for slums, it makes no sense that we actually continue to use indicators for urban, because there is no single entity called urban. You have a mix of different dynamics and different trajectories of disease profiles and of outcomes that affect slum and non-slum populations in different ways. And we need to begin to understand that. And the only way we can understand it is to be able to create indicators that are data systems that will allow us to identify slum clusters and be able to analyze their profiles differently from non-slum areas in the urban environment.